thank you for the opportunity to allow me to be here this evening to speak about Bill S5. I want to begin by thanking the committee member for the work it has done to help shape this bill. Votre rapport intitulé Vapotage vers l'établissement.
Your report entitled Vaping Towards a Regulatory Framework for E-Cigarettes shows how necessary it is to protect young people against the danger of nicotine addiction while allowing adult smokers to have access to vaping products as a less harmful source of nicotine. Bill S5 addresses the recommendations in this report. Your efforts have informed important sections of this bill. Colleagues, the need to update existing tobacco legislation is clear. As you know, smoking remains a major health issue here in Canada. Despite decades of progress, illnesses linked to smoking kill 45,000 Canadians every year, which means one person every 12 minutes. These statistics are disquieting, and as Minister of Health, I find them unacceptable. This is why our government is working at reducing the level of tobacco dependence in Canada from 25% in 2015 to less than 5% in 2035.
We need to recognize that tobacco use in Canada is changing. Vaping products like e-cigarettes are becoming more popular. From a public health perspective, we believe this poses both challenges and opportunities. Bill S5 strikes the right balance between protecting Canadians and leveraging the potential benefits of vaping products. It also addresses an important need by establishing a new legislative framework for the regulations of these products. This bill is a key element of the government's broader tobacco control agenda, which includes taking further action to ban menthol in tobacco products, implementing plain packaging requirements for tobacco products, and finally modernizing Canada's approach to tobacco control. Depuis qu'il y a été déposé, le projet.
Since it was tabled, Bill S5 has been thoroughly reviewed and has been amended. Last spring, the Senate Committee on Social Affairs, Science and Technology undertook a rigorous study of the bill. It heard from 22 witnesses representing 15 organizations. Witnesses included consumer advocates, tobacco and vaping industry representatives, public health experts, academics, and government officials. Their valuable feedback informed many of the recent amendments to the bill before you today.
Vaping is a less harmful alternative to smoking. I have heard from Canadians who believe that the vaping helped them quit smoking. Nevertheless, we must be cautious. There are risks to consider. Stakeholders have told us that they worry about how vaping products could affect young people. I want you to know that we share their concerns. We must ensure that the availability and prevalence of vaping products do not induce young people and non-smokers to develop nicotine addictions, which could lead them to start smoking. That is why Bill S5 would prohibit the sale of vaping products to youth under the age of 18, in line with the current minimum age of tobacco sales. Protecting youth from the dangers of nicotine addiction is a top priority of mine. I share some of the concerns expressed by the Quebec Coalition for Tobacco Control and others, especially regarding lifestyle promotion. We do not allow lifestyle promotion of tobacco products, and we do not intend to allow it for cannabis products. To protect youth and non-smoking Canadians, I intend to support an amendment that would prohibit all lifestyle promotion of vaping products. That said, I understand the potential of vaping products as a harm reduction tool. Marketing based solely on factual information will be allowed with restrictions. For example, there are concerns that certain flavors could potentially make vaping products more appealing to young people. We recognize that some adults prefer flavored vaping products, but we also know that certain flavors could attract youth to vaping, something that we absolutely want to avoid. For this reason, Bill S5 restricts the marketing and promotion of flavors such as candy, which would be appealing to youth. We have already taken significant action when it comes to flavored tobacco by expanding the ban on menthol to cover 95% of all tobacco products. Bill S5 was amended to go even further, to ban the use of menthol and clove in all tobacco products. We believe these measures will help protect Canadian youth from the serious, long-term health effects of nicotine addiction and tobacco use. Comme je l'ai mentionné plus tôt, le projet de loi S5.
As I mentioned earlier, Bill S5 is helping us advance in our goal of making having neutral or plain packaging for tobacco products. Because of measures brought in by the Government of Canada, the capacity of the tobacco industry to recruit new smokers, especially among the young, through advertising and the promotion of tobacco products has greatly decreased. Packaging is one of the last remaining channels for such promotion. Research shows that promotion through tobacco packages and product design is particularly effective with adolescents and young adults. When there are logos, textures, and brand names, it has enormous influence on young people, and it helps to make them loyal to a brand. Conversely, it has been proven that plain packaging decreases the attraction of tobacco products, especially among the young. 82% of daily adult smokers over the age of 25 smoked their first cigarette before the age of 18. And that's why, around the world, leaders in tobacco control are moving toward plain and standardized packaging for tobacco products. I think we can all agree that tobacco companies should not be able to use packaging to make a harmful product appealing. It's very important that this bill be passed in order that Canada, too, can implement these important and effective tobacco control measures.
A well-researched and balanced piece of legislation. It aims to protect young Canadians from developing nicotine addictions and from using tobacco. At the same time, it would allow adults to legally access vaping products as a less harmful alternative to tobacco. In addition, this legislation supports our government's efforts to implement plain and standardized packaging of tobacco products. Bill S5 reflects the considered opinions of many stakeholders, including public health experts, industry representatives, consumer advocates, and academics. The results of this strong piece of legislation that will allow us to regulate the growing market for vaping products and advance the tobacco control agenda.
And we've heard from many witnesses some concern about the prohibition on the promotion of flavors for vaping products. And you mentioned this in your remarks as something that was, we want to be strong about is prohibiting these flavors. Could you explain more why this measure is important?
Yes, thank you so much for the question. When we look at the objectives of Bill S5, really it's twofold. First of all, as Health Minister, my first priority is to protect the health and safety of our youth. And that's really moving forward one of the main objectives of this bill. But the other objective, as well, that I would say, is also to seize the opportunity. We recognize that there are several tobacco smokers right now that are wanting to switch from using tobacco to transferring to vaping products. And we absolutely can see that there can be some benefits to that as well. So moving forward, we certainly recognize that we don't want to allow young people to be encouraged to use vaping products. So that's why that moving forward, we certainly want want to ensure that there's strict regulations that are in place with respect to marketing and promotion, because we don't want them to be enticed to that at all. But on the other end of the spectrum as well, we also recognize that flavored products for some Canadians can certainly help them in order to kick the habit of smoking and use vaping as an alternative option there. With respect to going back to the youth as well, we absolutely want to make sure that any flavors that are going to be available, when we talk about the names that will be used for the flavors, the actual names of the flavors, once again, should not be appealing to youth in any way. So I'll just give an example. I think all kids like cotton candy, and probably several adults like cotton candy. But we certainly want to make sure that those types of names won't be used for the flavors of the product, because, again, that name would be appealing to children. So with respect to the adult population, we certainly want to make sure that they have access to the flavors, but once again, we certainly need to make sure that we strike that balance, that we allow it for adult consumers, but in no way is it going to be appealing to our youth.
Thank you, Minister. We've also heard from a number of witnesses the claim that vaping products are safer than tobacco products, and you mentioned that as well in your remarks. I'm wondering, how do we know this? How do we know that vaping products are, in fact, less harmful than tobacco products?
Well, thank you again for the very important question. I guess to answer that, I would first of all say that the research is very clear when it comes to tobacco. We know that tobacco kills Canadians. When we look at our annual statistics, we know that we lose 45,000 Canadians per year as a result of tobacco. So as I said in my remarks, if we break that down, that's 1 Canadian every 12 minutes that dies as a result of tobacco within this country. So we certainly recognize that it's an extreme risk, and that the research is there. Research shows that vaping products are less harmful than tobacco, but with that being said, it doesn't mean that it is without risks. So we recognize that if we look at the two substances, that we have one that is perhaps less harmful than the other. So when we look at harm reduction types of mechanisms, we certainly recognize that vaping products can absolutely be a safer alternative than smoking tobacco.
And Minister, thank you for appearing here. I'm very pleased to hear that you're open to amendments, recognizing that there are alternatives to smoking, that smokers who do want to quit may need some help, may need some adjustment. So I'm pleased to hear that you're willing to accommodate amendments that will allow this to be known, because as the bill stands now, a smoker who would want to look for alternative products, alternative nicotine products, would have no way of finding out about them, because there's no advertising allowed to them, presumably to their doctors or even to smoking cessation clinics, which I think you'd agree would not be in the best interests of public health. Would you agree?
Pardon me?
If people didn't know about these alternative products, that would not be in the best interest of public health. Do you agree? Mm-hmm. So there are products, we've discussed vaping here today. There are other products that can help, that have been proven very popular in the world. In fact, in Japan, non-combustibles, in less than 2 years, took over 10% of the market for smokers. They're expected to hit almost 20% of the market of smokers by the end of this year. Now, these products have been demonstrated to be far less harmful to smokers than cigarettes, and yet this bill doesn't recognize them and would lump them in with cigarettes, and therefore they would not allowed to be advertised either. How do you square that with the public health issue and safety issues that these products could provide?
Well, thank you very much, Ms. Finley, for your question. With respect to the combustibles, we've made it very clear that tobacco products are tobacco products. The research is very clear that tobacco is very dangerous and kills Canadians. So with respect to this piece of legislation that we're bringing forward, we are proposing the same types of requirements for all tobacco products. With respect to the information that will be available to Canadians with respect to alternatives, we certainly want to make sure that that information is based on science, and we certainly want to make sure that if there's appropriate information that's available to be provided to Canadians, we absolutely want to make sure that that is going to be allowed. However, it has to be based on science. We've made a recommendation that if there's any informational type of material that is available, that Health Canada will certainly look at the information, and then from there make the best decision to ensure that that information is factual, based on science, and then from there that would be provided to Canadians.
Would studies from other countries be acceptable?
We would certainly look at studies. However, we have to also make sure that those studies are not being sponsored by any type of manufacturer, to make sure that it's based on science and not by being influenced by industry.
Well, we heard on Monday there were allegations that some of the research was funded, and this committee was led to believe that some of the research had been funded by quote-unquote big tobacco, when in fact the people who had done the research said flatly they had not been. So you need to do the research on that as well, to make sure that you're not being led down the garden path in terms of a bias there, because as a smoker, I'd like to know what alternatives are available, but this bill won't let me find out.
Minister, I want to congratulate you on bringing this legislation in. I think it's overdue. I would have wished that you brought it in sooner, because we all know that every day we wait, thousands of young Canadians try smoking, and many of them become addicted. And we know that 50%, I think is the statistic we heard, of people who start smoking will eventually die of a tobacco-related illness. So every day that we wait is a day that more Canadians are going to die, ultimately, of this highly addictive product. Now, my question to you, as Health Minister, and we're the Health Committee, do you agree that nicotine is highly addictive?
Yes.
Do you also agree that nicotine, in whatever form that it's marketed, is something that, as a Health Minister, we should be taking every step we can to discourage Canadians from using?
Mm-hmm. Yes.
Yeah. And of course, we all know that nicotine itself is highly addictive. So once people start, no matter how it's ingested, it's very difficult to quit. So I'm glad to hear that you have seen one of the major flaws in this bill. We heard testimony on Monday from a variety of groups that spoke to the promotion and advertising of vaping products. Now, we all know that vaping is it's a purer form of nicotine delivery. But as you just acknowledged, and I think you're right, we don't want Canadians to become addicted to nicotine. So the value of the vaping that we heard at this committee in testimony was that it's probably 95% estimated safer than tobacco ingestion. And it's very useful and promising, perhaps, as a harm reduction method, a smoking cessation tool for smokers. So my question then to you is, why did this legislation come forward, almost 3 years after it was promised, with provisions that would allow tobacco companies to market vaping with promotions, with advertising, to use billboards, television, radio, internet, video games, newspapers, corner store windows, bars, text messages, social media. They could use contests, trips, draws, tickets to concerts, sporting events, which are all directed at people who don't smoke, therefore leading them to be more likely to pick up the habit of vaping and ingesting nicotine. Is it those provisions of this bill that you in your opening statement said we should amend?
Absolutely. Again, as Health Minister, my responsibility is the health and safety of Canadians, and my specific priority when I look at Bill S5 is also, I've got to say that I've got a bias with respect to youth. I really want to make sure that we keep these products out of the hands of our youth, and we also want to prevent our Canadians and our young people from being addicted to nicotine. You're absolutely right. So in moving forward, we've been working very hard to ensure that this bill gets through the Senate and also the House, to ensure that we can get this to fruition. With respect to the area of the amendments that I've indicated in my opening statements that I absolutely welcome an amendment to, is the area of lifestyle promotion. I in no way feel that that should be allowed in the public sphere. We recognize that we need to limit that, and as a result, because we certainly want to ensure that Canadians are not going to be enticed to start smoking, either our youth or also our adults that aren't smokers now.
I was going to get to that too, because these are all advertising that could be directed at people in bars. So one of the suggestions we heard was that if it's really our goal to use e-cigarettes and vaping as a smoking cessation tool directed at smokers and not at the general public to encourage them to pick up nicotine, The suggestion was to keep the advertising to the cigarette package so that you're delivering the direct message to the smoker every time they buy a pack of cigarettes, while eliminating the possibility that vaping marketing will be directed at non-smokers. Would that be something that you would support?
I'm sorry, I didn't. Can you?
Yes, ban all advertising and promotion of vaping other than on the cigarette packages. If our goal is to direct the message to smokers that vaping exists, so that they can use that to maybe pick up vaping as a safer method of ingesting nicotine.
The information with respect to promotion and marketing of these types of products is very, very restrictive. And the information...
It's not.
It's still very restrictive. We certainly want to make sure that there's informational type of products that will be available to Canadians, but it's in no way wanting to encourage, with respect, when we look at the lifestyle amendments that I'm proposing,
okay,
we are certainly looking at making sure that that information will be very, very restrictive. Mm-hmm. So it's going to have to be based on science. People are not going to be able to just come up with slogans with respect to that.
We've heard some claims that vaping is less harmful, and that yes, in itself is less harmful. Are you aware of any trends or research indicating that those who've never smoked, who start smoking or who start vaping, are likely to go on to smoking tobacco?
I haven't seen any specific research with respect to that, but with the proposed Bill S5, that's why that it's really important for us to strike that balance. We really want to make sure that we in no way promote vaping, the vaping products to children that are under the age of 18, or to promote it to anyone that's a non-smoker at this point in time. We don't want to create another generation of people that are addicted to this substance. So that is why, with respect to our marketing and our promotional types of material, we're very restrictive to ensure that they don't encourage young people to want to start this habit. But with that being said, as I've also indicated, we also recognize that it can be a very good harm reduction type of approach when it comes to smokers. So we certainly want to ensure that the products are available for those smokers right now, with the hope that they are going to be able to wean themselves off. I think, once again, we're talking about apples and oranges here, and I think we have to be very, very clear. We are moving forward with Bill S5, and with respect to the issue of flavors, we want to make sure that there's strict restrictions that are in place to ensure that in no way these products will be attractive to children. We also recognize, however, that there are benefits to adults who choose to want to use these products. Going from smoking to using vaping products, the evidence is clear that it's less harmful, and that is why they're moving forward with this balanced type of regime to ensure that we can offer the products to those who need it.
Thank you very much. Mr. Oliver, 5 minutes.
Thank you, and thank you very much for being here. Welcome back to the Health Committee. So there's been a good discussion already about the balancing act that's here in S5. On one hand, we want to get our youth away from nicotine, away from tobacco. If we don't want them to be enticed or brought in to become addicted to nicotine. For me, that is the number one priority. I've heard you say that as well. That is, to me, what must happen, and that's what S5 is continuing to further. We have a second item, though, which is trying to move adults who have tobacco smoking habits onto a healthier way of consuming nicotine than smoking. So those are the competing agendas. Personally, I don't think the balance is there. I think you've mentioned a few times that you think it's there. So I was delighted to hear that you are entertaining an amendment on lifestyle. And I think that's a very important one, so thank you for that. The second one, though, is on location of advertising and location for vapor product advertising. I have a 13-year-old son. So I don't want to be at my neighborhood bus stop with him with a vaping advertisement on my local bus stop. I don't want to go to the movie theater and try to explain, what vaping is and why vaping is a product that's being advertised. I don't want to go to the local hockey rink and explain to him what vaping is and why it is. So location is a critical issue. And I believe that the way it's set up now, we're going to be exposing young Canadians to vape products when we don't have to. So the Canadian Cancer Society was very strong on this one. So the Minister, what they said about S5 was the vaping restrictions are weaker than the Tobacco Act and Bill C-45 for cannabis. that the vaping product advertising restrictions are weaker than almost every other developed country except for the United States, and that the location, these are all location advertising, and the provisions regarding the location of vaping advertising are so weak that they resemble those of the 1964 tobacco industry advertising. So I guess my question to you is, would you please consider, and I'd like to bring one forward, an amendment that also restricts the location of advertising for vaping. I think there's lots of ways to communicate to adults who are smokers that vaping is a better way to consume nicotine than putting it on hockey rink boards. So would you consider an amendment on location?
Well, thank you very much, Mr. Oliver, for your question. And yes, as you've indicated with respect to the lifestyle advertisement, I'm very open to an amendment with respect to that, as we've heard a lot of testimony over the past few weeks with respect to that. So I'm, like I said, I would welcome that type of amendment, because we certainly want to make sure that we are in no way encouraging non-smokers, non-vaping users to get into that. I'm getting it, yeah. Okay. So with respect to the area of location of where the actual factual information can be placed, and once again, it's not advertisement with promoting the product, but basic factual information with respect to vaping. I've been advised that we have extensive regulatory powers to choose as to where that information can be posted actually, in actual fact. So within the regulations, we do have the powers of controlling where those types of ads or that type of information can be placed.
Why wouldn't we just restrict it to the point of sale? I don't see a need for that advertising. But what worries me, and I haven't mentioned it, but the Cancer Society also wanted to make sure that there was restrictions on advertising brand or brand preference advertising. So you are going to get a much more exciting, even though you're stopping lifestyle, you're going to get promotion of vaping products with branding and with other ways of it. Like the cigarette industry has learned to do this stuff like nobody else on the planet. They can make a product look exciting. I saw little cigarettes that were glittery and looked like a tube of lipstick. So they can make this stuff look incredibly exciting. So I think if we don't restrict location, we're going to see exciting vaping products, just because they've been marketed that way, although they're not really lifestyle, on hockey rinks and all over our communities. So I would encourage again that you think about accepting an amendment on location.
Okay, thank you.
Do you want to respond?
Thank you. And again, as indicated, with respect to the regulations that are in place, we absolutely do have the authority to restrict as to where that marketing is going to be. I think as well, we have to ensure, however, that we have to also strike that balance, because we also want to target the individuals that are the smokers, that we want them to be able to move on to the vaping alternative. Again, as I've indicated, in no way am I saying that vaping is harmless. We know that there's harms associated to it, but we also recognize that the use of tobacco is even more dangerous. So that is why it's important for us to kind of strike that balance between the two. But it's a point very well taken, and that is why that within our regulations that we do have the power to be able to choose where those locations can be.
Thank you very much. And now we go to Ms. Gladue.
Thank you, Chair, and thank you, Minister, for appearing. I want to talk a bit about young people and vaping. I'm very concerned that young people are going to, they're going to see vaping because you'll be able to vape wherever you can smoke. And we heard some very disturbing statistics in our previous testimony about the number of young people that have already tried vaping and the likelihood that once they get vaping, they will actually begin smoking. And so if I look at the existing situation, we've got these illegal vape shops. And when the regulations are brought in to regulate the industry, they've not had a great track record at keeping these things out of the hands of children. The convenience stores, on the other hand, have a very good track record in terms of making sure that, they check age before they are selling tobacco products. So my question is, what are we going to do in terms of inspection, auditing, or whatever on these operations that are vaping operations that are illegal today? And will we allow the convenience stores to participate in the vaping sales?
Well, thank you very much for the question. And you bring up some very good points, Ms. Gladue. With respect to protecting the youth, that is absolutely a priority of mine as Health Minister. We recognize that at this point in time, when we look at the vaping industry in Canada, it is worth millions of dollars. And at this point, this system is completely unregulated. So we recognize that people are selling products all over the place. The products that they purchase are unregulated. We don't know where they come from. And also the devices that they use to vape as well. There's no requirements there at all. So that is why that Bill S5 is so important, because we certainly want to make sure that the rules are put in place in order to control these types of products. And keeping it out of the hands of our children is absolutely a priority. That is why that setting the minimum age of 18 with respect to consumption to use is absolutely a step in the right direction, because just as you've indicated, we certainly want to make sure that the area of them being able to have access to it is going to be extremely limited. With respect to the sales of the products, I'm going to be frank, I'm going to have to turn it over to one of my officials as to exactly where it's going to be sold, because I don't have the specific details regarding that. So if I can turn it over to James, perhaps, or to Denis, they've told me. So.
Yes, we have 8 provinces who already have measures in place for limiting sales to youth of vaping products. What we do nationally is establish a minimum across the country. So already there's been measures put in place in a number of provinces. They have tobacco inspectors. We also have tobacco inspectors. We've worked together, as I said on tobacco before, we'll be working together as well on vaping. Some provinces will have ability to decide who will sell tobacco products and vaping products. We don't already for tobacco products. For example, many provinces have banned the sale of tobacco products in hospitals or in schools, universities, and so forth. Vaping products, they will also have to decide where those sales will be taking place. It's not something we would do federally.
Certainly, we want to reduce the people who use tobacco product. And you said, even though Cancer Society, there's some evidence, reduce the impact of tobacco when using the vaping product. What kind of research has been done to ensure these products are safe? Number 2, what are the plans for ongoing research to track the safety of these products?
Thank you very much, Ms. Sidhu, for your question. Once again, we recognize that the vaping industry is a very new industry, and as a result, the research is fairly new as well. But we certainly continue to monitor all research that's available, and what we see thus far is that vaping products shows that it's safer than tobacco use. Again, we're not saying that it's without any harms that are associated to it, but we certainly recognize that when we look at the level of risk, it's less harmful than tobacco use is. With respect to vaping as well, we continue to invest in that area. In the area of CIHR, there's some investments, some research that is presently being done there. And again, we continue to monitor all the research because we certainly want to make sure that if there's any changes that are going to be needed, we certainly want to be able to address that, very quickly.
And is there any public education campaign is running for the tobacco harm and nicotine addiction?
Yeah. With respect to the issue of public education and awareness, there is an investment of $6.1 million in the area of public awareness in education with respect to vaping products as well, because again, it's a very new product that's on the market. And we also want to make sure that people are aware of the risks that are associated to vaping, but also to provide them with the basic information that they need. So investments will be made in that area because we certainly want to make sure that we provide information to parents, to children, to everyone with respect to the harms related to these types of products.
Thank you.
Very much, Mr. Davidson. 3 quick minutes, please.
Thank you. Minister, Health Canada has not commissioned an anti-tobacco marketing campaign since its suspension of federal anti-tobacco ads in 2006 when the Harper government took office. That's not surprising to me given the Conservatives' defense of big tobacco, but according to spending figures from Health Canada, the Health Department under your government spent nothing on a national advertising campaign in the mass media for the federal tobacco control strategy in 2015-2016. Why is that?
Well, as I've just indicated, however, there's $6.1 million that we are going to be investing in the area of public education and awareness with respect to this area. We certainly feel that it's extremely important to make sure that Canadians are aware of the harmful effects associated to vaping products and to the use, and we are going to be moving forward with those types of investments.
So you acknowledge that so far, from 2015 to 2018, your health department has not spent any money on mass media, on national advertising campaign, on anti-tobacco.
Well, with respect to it, we've launched our new tobacco strategy, and once again, we're certainly making strides moving forward with respect to that. If we want to reach our 2035 targets of having less than 5% of Canadians that are going to be consumers of tobacco, and we're going to do all that we can to ensure that we can meet that target.
I would suggest that part of doing something would be to start to bring in a national federal advertising on tobacco. You could bring that back. I want to talk about the flavoring. I don't think that you satisfactorily answered Mr. Albus's questions. I don't know if you understand that in Schedule 3, the flavors are set out specifically. So the question is if there's flavors that aren't listed as prohibited on Schedule 3, then that leaves it open to the market to market under other attractive flavors. That's, I think, the question. What's your response to that?
Once again, with respect to the regulations and the proposal that we brought forward in Bill S5, we absolutely want to make it clear that there is going to be no names of flavors that are going to be attracting children.
You plan on supplementing in the regulations what's in the schedule presently? We
absolutely want to make clear that there is no names of flavors that are going to be appealing to children.
I guess I want to end with this lifestyle. I'm not sure that I'm clear on this. S5 does restrict the kinds of ads for vaping products that are allowed in public places. Those that are reasonably attractive to youth or lifestyle. That's Section 30.2. But it places fewer restrictions on ads in adult-only venues like bars, where lifestyle ads and purchase incentives are permitted. That's 30.3. So in Alberta, 18-year-olds are in bars, and they're inside getting lifestyle ads on vaping, and I thought you said that you don't want to promote vaping to anyone. So is that the kind of problem in this bill that you want to correct?
Absolutely. With respect to any type of lifestyle ads, I truly don't feel, like I said, I would welcome an amendment with respect to that, because I feel that we certainly don't want to send that message specifically to young people, but young people as well that are not consumers of tobacco nor vaping products.